My name's Nicole. And I'm Autumn. And we're here to give you a bed bath.
That sounds
Yeah.
great.
Can you tell me your name and your date of birth?
My name is Evelyn Smith, 2/26/1910.
After verifying the healthcare provider's orders, they gathered the necessary equipment and supplies,
Just gonna check your armband here.
performing hand hygiene, providing for the patient's privacy, and introducing them to the patient and family if present. Identify the patient using two identifiers such as name and date of birth. They then assess the patient's tolerance for bathing and activity, comfort level, cognitive ability, and musculoskeletal function.
Are you having any pain today? No, no pain.
Okay. Alright.
Encourage the patient to void prior to beginning the bath.
Do you need to use the restroom before we start with your bed bath?
No, I'm okay. Thanks for asking.
Okay.
Apply clean gloves and arrange all supplies on the overhead bed table.
Wash my hands.
Raise the bed to a comfortable working height. Lower the rail on your side to help the patient assume a comfortable supine position, maintaining body alignment.
Got my nice warm water. Miss Smith,
Yeah?
can you stick your hand in here and tell me how the water feels?
Oh, that feels good.
Alright.
Place a bath blanket over the patient. Have the patient hold the top of the bath blanket, if able, and remove the top sheet from beneath the bath blanket without exposing the patient. Place soiled linen in a dirty linen bag.
Okay. So how have you been lately, Mrs. Smith?
Living the dream.
Yeah?
Yeah.
Alright. I'm gonna pull this down here. Might wanna move your table out a little bit.
Remove the patient's gown or pajamas. Whether or not the patient has an intravenous
Take
line
your gown
supply, simply unsnap the sleeves and remove the gown.
Alright. Yep, yep, I got it. Okay.
We're gonna start with your face and neck.
Going in a soiled utility, or soiled linen bag.
Washing the patient's face. Inquire whether the patient was wearing contact lenses.
Can you lift your head and put this towel underneath? Do you wear contacts or anything?
No, I don't.
Immerse the washcloth and wring it out thoroughly. Warm a mitt with the washcloth. Wash the patient's eyes with plain warm water, using a cleaning area for the cloth for each eye. Bathing from the inner to outer canthus. Soak any crust on the eyelid for 2 to 3 minutes with a damp cloth before attempting to remove them. Dry gently and thoroughly around the eyes.
Would you like soap for your face, or would you like it just plain water?
Just water.
Alright.
Wash, rinse, and dry the forehead, cheeks, nose, neck, and ears. Ask male patients if they wish to be shaved. In providing eye care for the unconscious patient, instill prescribed eye drops or ointment per the physician's order. In the absence of a blink reflex, keep the eyelids closed. Close each eye gently using the back of your fingertip before taping in place an eye patch or shield. Do not tape the eyelid itself.
Gonna dry your face here.
In washing the upper extremities and trunk, remove the bath blanket from beneath the patient's arm that is closer to you. Place the bath towel lengthwise under the arm. Bathe with water and minimal soap, using long, firm strokes and moving in a distal to proximal direction.
Right.
Rinse and dry the arm.
Gonna wash your arms now.
Alright.
You doing okay, Mrs. Smith?
I'm doing fine.
Soap on here.
So how long have you been here?
Days all blur together. I'm not really sure.
Well, that's not good.
I like it here though. The bingo's really intense.
Yeah? Well, that's good. I'm glad you enjoy the bingo. You want anything there?
I think I want some candy.
That's really nice that you get candy. I don't get candy.
I give it to my grandkids. I have 36 of them.
Wow, that's
Yeah,
a lot of
It
grandkids.
is. I think they have a TV show or something.
I can see that.
Gonna wash your hands now.
Wash the hands and nails. Fold a bath towel in half and lay it on the bedside beside the patient. Place the wash basin on the towel. Immerse the patient's hand and allow it to soak for 3 to 5 minutes if necessary. Before cleaning beneath the fingernails, remove the basin and rinse and dry the hand well. Raise and support the arm above the patient's head, if possible, to wash, rinse, and dry the axilla thoroughly. Apply deodorant to the axilla if the patient desires.
Soap here. Gonna lift your arm up here. Do you want any deodorant on?
No, thank you.
Move to the other side of the bed and repeat these steps with the patient's other arm, axilla, hand, and nails.
Okay. I'm gonna do this side now, Miss Smith. Lift your arm. Washcloth, please. Soap. Thank you. Wash your arm here. Make it one with just water. Put this in the hamper. Thank you. That off. Okay, now I need other ones so I can wash your hands with some soap. Thank you.
Are you warm enough?
I am. Thanks for asking.
I love the color of your polish on your nails. I need one with this water.
Thanks. It's called Sassy Grandma Red.
Oh wow,
Yeah.
I love the name. So who painted your nails?
Oh, one of the girls in here. I don't know her name.
Oh, that was very nice of her.
She's sweet.
each chest with a bath towel and fold the bath blanket down to the umbilicus. Bathe the chest using long, firm strokes. Take special care with the skin beneath the female patient's breasts, lifting each breast upward if necessary, using the back of the hand. Rinse and dry well.
All right.
You still warm enough?
Yeah.
Okay.
Guys made it a perfect temperature in here.
All right. I'm gonna wash your chest and your breasts, okay?
Okay.
Do you want some powder under there?
No powder, please.
Make sure to check the temperature of the bath water and change the water if necessary.
Gonna rinse you off here.
I'm gonna dry it here a little bit. Okay. Gonna get your tummy now.
All right. We're gonna check the water here and see if it's an okay temperature for you. Does that feel okay?
Oh, that feels still good. Thank you.
Mhm.
Wash the abdomen. Place a bath towel, 2 if necessary, lengthwise over the chest and abdomen. Fold the bath blanket down to just above the pubic region. Bathe, rinse, and dry the abdomen, paying special attention to the umbilicus and the surrounding skin folds of the abdomen and groin. Keep the abdomen covered between washing and rinsing. Dry well.
Dry her up. Dry your tummy here.
Put a clean gown or
Okay.
pajama top on the patient by dressing the affected side first. If you wish, you can postpone this step until the bath has been completed.
Would you like to get your gown on now, or do you want to wait till after we're completely done?
Oh, it doesn't really matter to me. Whatever you sweet girls want.
All right, Kat. We'll get your gown on for you. Put your arm in here first.
See this arm? Bend your elbow here. Go.
How does that feel?
Perfect.
When washing the
Would you
lower
like-
extremities, cover the chest and abdomen with the top of the blanket. Expose the leg closer to you by folding the blanket up toward the midline.
Would you like this tied up?
Sure.
Go.
Yeah.
That's my trash. I'm gonna go wash my hands and I'll be right back. Wash my hands. Are you still comfortable?
can.
Sorry. It's taking that rain.
Can you?
Huh?
It's okay, I'll wait for you to get your gloves on.
Sorry. Okay. Alrighty.
Be sure the other leg and the perineum remain draped. Place the towel lengthwise under the leg.
I'm gonna lift your leg here.
Alright.
Wash the leg using long, firm strokes and moving from the ankle to the knee and then from the knee to the thigh. As you work, assess for signs of redness, swelling, or pain. Thoroughly rinse and dry the leg.
Alright, I'm gonna wash your leg here.
Wash the foot, making sure to clean between the toes. Clean and file the nails as needed or per agency policy. Rinse and dry the toes and feet completely.
Gonna wash your feet.
Remove the towel and move to the other side of the bed. Repeat the steps 15A, B, and C. Wash the leg using long, firm strokes. Wash the foot, making sure to clean between the toes.
Alright, I'm gonna wash this side here for you. You can wash off, please, with a little bit of soap. Thank you. Alright. I need one to rinse off. Thank you. Thank you. Alright.
Apply a light layer of moisturizing lotion to both feet.
Dry this off while she gets that. Thank you. Washing your feet here. Your feet aren't very sensitive, that's good. A lot of people think this tickles. Thank you. Get all the soap out of there. Dry this off. Your skin on your feet look really good.
Do you want lotion on your feet?
Yes, please.
patient is supine. Provide perineal care.
I'm gonna take and get us some fresh water.
Okay.
Take these off. Trash. Okay. Almost forgot, you're real. Alright. Wash my hands. Dumping the old water out, getting fresh water. Miss Smith, can you check and make sure this is warm enough here? How
Yep,
does
that
it
feels
feel?
good.
Okay. Set that over there. Thank you.
Mhm.
Wash your hands.
For perineal care for a female patient, form hand hygiene, provide privacy, introduce yourself and identify the patient, explain the procedure and its importance for preventing infection. Perineal care for the female patient. If the patient is able to maneuver and handle a washcloth, allow her to cleanse the perineum on her own. Note any restrictions or limitations on the patient's positioning. Help the patient into a dorsal recumbent position if there are no limitations. Place a waterproof pad under the patient's buttocks. Drape the patient in a bath blanket placed in the shape of a diamond. Lift the lower edge of the bath blanket to expose the perineum.
Alright, ready. I'm gonna wash your up here.
We're gonna wash your perineum, okay?
Okay.
Alright, I'm gonna put your leg up here.
Are you okay?
I'm okay.
There we go.
Wet and wring out the washcloth. Applying a cleansing product to the washcloth. Wash and dry the patient's upper thighs. Rinse and dry this area.
Alright, I'm gonna start with your thighs, okay?
I'm gonna wash this side. Can I get one to rinse? Thank you. Dry it off.
Wash the labia majora. Use your non-dominant hand to gently retract the labium from the thigh. Use your dominant hand to wash carefully within the skin folds. Wipe from the perineum to the rectum. Repeat on opposite side using a separate section of the washcloth. Rinse and dry the area thoroughly.
Are you doing okay?
Yeah, I'll do it fine.
Your hands get sticky when they're in gloves for a while. touch down here, okay? You're gonna feel my touch again. Alright, and I'm gonna rinse you off.
Alright, gonna dry you here.
Alright, touch off.
Go ahead and relax your legs now.
You're doing good. We're almost done.
Before washing the back, apply a clean pair of
Wash the
gloves.
hands.
Help the patient assume a prone or sidelined position if applicable. Place a clean towel lengthwise along the patient's side or back.
Can you hand me a pair of gloves, please?
Yes, ma'am.
Thank you.
Welcome.
Your hands aren't sweaty.
Alright.
Alright, we're gonna stick this pillow between your legs here. So we're gonna wash your back, and then it'll make it easier when you turn to have this between your knees.
Okay. Gonna put this up here. Okay. I'll move her towards you a little bit.
Yep.
And 3. 1, 2, 3.
Okay.
All
And then you
right.
bend your knee here.
Have your arm here.
Turn onto your right side.
Put your pillow here for you.
If fecal material is present, enclose it in a fold or under pad or toilet tissue and clean the area with disposable wipes. Keep the patient draped by sliding the bath blanket over the shoulders and thighs during bathing. Wash, rinse, and dry the back from neck to buttocks using long, firm strokes.
Gonna wash your back. Can I have one rinse with, please? Thank you. I'm gonna dry you off here. Alright, can I get a washcloth, please? I'm gonna wash your bottom now.
Cleanse the buttocks and anus, moving from front to back. Pay special attention to the folds of the buttocks and anus. Rinse and dry area thoroughly.
Rinse with, please.
If needed, place a clean absorbent pad under the patient's buttocks.
You doing okay, Mrs. Smith?
Yeah, I'm doing fine.
the patient's skin is intact, remove your gloves and give the patient a back massage if he or she would like one.
Would you like your back massaged and some lotion on there?
Oh, that sounds great.
There you go.
Yeah, I don't have washing my hands.
There you go.
Apply body lotion to the skin and topical moisturizing agents to dry, flaky, reddened, or scaling areas. When you are finished, cover the patient with a bath blanket. Put a clean gown or pajama top on the patient by dressing the affected side first, if not done earlier.
Have the extra off for you. There you go.
Alright, we're gonna roll you back, okay?
Assist the patient with grooming. Comb the patient's hair. Be aware that female patients might wish to apply cosmetics. Apply gloves to make the patient's bed.
Do you want your hair done?
Oh no, I think it's okay.
All right.
If linen is soiled, remove it and place it in the dirty linen bag. Do not allow contact with your uniform. Clean and replace bathing equipment. Remove gloves and perform hand hygiene. Check the function and position of external devices such as indwelling catheters, nasogastric tubes, intravenous tubes, and braces. Replace the call light and neatly arrange personal possessions. To ensure patient safety, place the bed in the locked, low position with at least two but no more than 3 side rails raised. Make sure the patient is as comfortable as possible.
Here's your call light. Are you comfortable?
I'm very comfortable, thank you.
Okay, do you need anything else while we're in here?
Oh no, thanks.
Dispose of all used supplies and equipment. Perform hand hygiene. Document and report patient's response, unexpected and expected outcomes. Record the procedure, including how much the patient participated and how well the patient tolerated the bath.
Bed's kind of slow today. There we go. Alright, gonna take my trash bag and my linen bag out. Wash my hands.
Verify the healthcare provider's orders. Gather the necessary equipment and supplies. Perform hand hygiene and provide privacy. Introduce yourself to the patient and family if present. Explain the procedure and its importance to preventing infection. Identify the patient using 2 identifiers, such as name and date of birth, or name and account number, according to agency policy. Compare these identifiers with the information on the patient's identification bracelet.
Hi, I'm Parker. I'll be your nurse today. Can I get your full name and date of birth, please?
My name is John Smith. It's 6/12/47.
Very good, thank you. I'll be giving you pericare today.
Bring the head of the bed to the appropriate working height. Apply clean gloves. Check the water temperature.
Is the water all right for you?
Yeah, that's good.
Okay.
Perineal care for the male patient. If the patient is unable to maneuver and handle a washcloth, allow him to cleanse the perineum on his own. Note any restrictions or limitations on the patient's positioning. Help the patient into a supine position. Place a waterproof pad under the patient's buttocks. Drape the patient with a bath blanket placed over the abdomen. Wash, rinse, and thoroughly dry the upper thighs. Thoroughly dry the upper thighs. Cover the thighs with a bath towel. Raise the bath blanket to expose the patient's genitalia.
Are you warm enough?
Yeah, I'm doing okay.
Gently raise the penis and place the bath towel underneath. Gently grasp the shaft of the penis. If the patient is uncircumcised, retract the foreskin. If patient has an erection, defer the procedure until later. Wash the tip of the penis at the urethral meatus first. Using a circular motion, cleanse from the meatus outward. With a separate section of the washcloth, continue until the tip of the penis is clean. Rinse and dry the tip of the penis gently and thoroughly. If the patient is uncircumcised, return the foreskin to its natural position. Gently cleanse the shaft of the penis and the scrotum by having the patient abduct his legs. Pay special attention to the underlying surface of the penis. Lift the scrotum carefully and wash the underlying skin folds. Rinse and dry the area thoroughly from front to back. Observe the perineal area for redness, swelling, irritation, discharge, or signs of skin breakdown that persist after performing perineal hygiene. Remove the towel and bath blanket. Pull the patient's gown down and the blankets up. Help the patient into a comfortable position and place toiletries and personal items within reach.
Is that comfortable? Do you want the head of the bed up?
Yeah, could you raise it a little bit? Okay, that's perfect, thanks.
Okay, I'll leave your call light right here for you.
Dispose of gloves in the receptacle. Place the call light within easy reach and make sure the patient knows how to use it to summon assistance. To ensure the patient's safety, raise the appropriate number of side rails and lower the bed to the lowest position. Perform hand hygiene. Document and report the patient's response and expected or unexpected outcomes.
Perform hand hygiene. Assess the environment for safety, such as checking the room for spills, making sure equipment is working properly, and ensuring that the bed is in the locked low position. Pull the room divider curtain or close the room door to provide privacy. Clean Clean linen should be stacked in the order that it will be used. Apply gloves to remove the soiled linen. Lower the side rails on both sides of the bed and raise the bed to a comfortable working height. Loosen the top linen at the foot of the bed. Remove the bedspread and blanket separately. If they are soiled, place them in a linen bag or a linen hamper, holding them away from your uniform. If the blanket or bedspread is to be reused, fold into a square and place on the corner. Remove the pillowcase and leave it on the bed. Place the pillow on the chair. Position the mattress and wipe off any moisture using a washcloth moistened with antiseptic solution. Dry mattress thoroughly. Apply all bottom linen on one side of the bed before moving to the opposite side. Make sure the fitted sheet is placed smoothly over the mattress and over the top and bottom mattress edges. Fit the corners on one end and then on the other. Apply a draw sheet or a waterproof pad, laying the center fold lengthwise along the middle of the bed. Smooth the draw sheet or waterproof pad over the mattress and tuck the excess edge under the mattress, keeping your palms down. Place the top sheet over the bed with the vertical center fold positioned lengthwise down the middle of the bed. Open the sheet out from the head to the foot, being sure the top edge of the sheet is even with the top edge of the mattress. Tuck in the remaining portion of the sheet under the foot of the mattress. Then place the blanket over the bed, with the top edge parallel to the top edge of the sheet and 15 to 20 centimeters down from the edge of the sheet.
Which side? The top?
Make a cuff by turning the edge of the top sheet down over the top edge of the blanket and bedspread. Standing on one side at the foot of the bed, lift the mattress corner slightly with one hand, and with other hand tuck the top sheet, blanket, and bedspread under the mattress. Make a modified mitered corner with the top sheet, blanket, and bedspread. After making a triangular fold, do not tuck the tip of the triangle. of the bed and fan fold the sheet 5 to 10 centimeters across the bed. Place the sheet up from the bottom to make the fold approximately 15 centimeters from the bottom edge of the mattress. Fan fold the sheet, blanket, and bedspread at the foot of the bed with the top layer ready to be pulled up. Apply a clean pillowcase. Pick up the center of the closed end of the pillowcase. Hold the pillowcase with a firm grip in one hand. With the other hand, open the pillowcase from the open end and fold the back over the closed end. Pick up the pillow with one hand holding the pillowcase. Invert the pillow for the pillowcase to drape over the pillow. Pull the pillowcase over the pillow with the other hand. Do not place the pillow or pillowcase under the chin, and the teeth are under the arms. Adjust the corners of the pillowcase with the hands between the pillowcase and the pillow. Do not shake the pillow to position the pillowcase. Place the call light within the patient's reach on the bed rail or pillow and return the bed to its lowest position to allow for patient transfer. Help the patient into bed. Place the linen bag into an appropriate receptacle. Remove and dispose of your gloves. Arrange and organize the patient's room and perform hand hygiene.
Perform hand hygiene. Verify the healthcare provider's orders. Assess any activity or mobility restrictions that might affect patient position, as the patient's safety and comfort are of the utmost priority. Assemble the necessary equipment and supplies on the bedside table. Provide for the patient's privacy. Introduce yourself to the patient and the family if present.
Hi Parker, we're going to be your nurses today. We're going to be changing your bed sheets. Can you tell me your full name and date of birth?
Parker Ensing, 8994.
Alright, perfect.
Parker, do you think you're okay if we lower this bed?
I think so.
Okay.
Identify the patient using two identifiers such as the name and date of birth or name and account number according to agency policy. Compare these identifiers with the information on the patient's identification bracelet. Explain the procedure to the patient. Check the floor for spills. Make sure the bed is in locked position. Assemble the linen on a clean, dry bedside table and in order of use. Raise the bed to a comfortable working height and lower the head of the bed as much as the patient can comfortably tolerate. If the patient is on aspiration precautions, keep the head of the bed no lower than at a 30-degree angle. Apply a clean pair of gloves. Loosen the top linen at the foot of the bed. Remove the bedspread and blanket separately. If they are soiled, place them in the linen bag. If either is to be reused, fold the item into a square and place it over the back of a chair. Cover the patient with a bath blanket, placing it over the top sheet. Have the patient hold the top edge of the bath blanket or tuck the blanket under the patient's shoulders. Reach beneath the blanket and remove the top sheet. Discard the top sheet in the linen bag. Lower the side rails on your side of the bed. Help the patient into a side laying position facing away from you. Encourage the patient to use the side rail to turn, then adjust the pillow under the patient's head.
Alright, we're going to have you roll this way, alright? So when you roll this way, you can hold on to this for support. Okay? Touch your arm. Okay? 1, 2, 3.
sure no tension has been placed on any external medical devices. Remove gloves and perform hand hygiene. Apply clean linens to the exposed half of the bed in separate layers. Place the fitted bottom sheet on the bed lengthwise. Secure the top and bottom corners on the near side with the center crease in the middle of the bed. Fan fold this layer of bedding to the center of the bed along the side of the patient's torso. Repeat this process with the bottom sheet and the draw sheet or waterproof pad.
Are you still doing okay?
Doing alright.
Alright. Okay. Alright, we're gonna roll you back over and you're gonna go over a bump, okay? Alright. 1, 2, 3. Up. And roll back. We're gonna roll towards my way. Go ahead and grab this side of the rail. You okay like that?
Okay.
I'm gonna put this pillow under your head. That might be
Raise the side rails and ask the patient to turn toward you. Tell the patient that he or she will be rolling over layers of linen. Help him or her do so if necessary. Make sure the patient turns slowly, keeping the body in correct alignment. Move to the opposite side of the bed and lower the side rail. Help position the patient over the fan folded linen on the other side of the bed. Loosen the edges of the soiled linen from beneath the mattress and remove it by folding it into a bundle or square. Hold the linen away from your body and place the soiled linen in the linen bag. Clean, disinfect, and dry the other half of the mattress as needed. Remove and dispose of gloves. Raise the side rails and perform hand hygiene.
ready to roll back. Alright, Breck, go ahead and roll back. Lift your legs up for us, thanks.
Lower the side rails and pull the clean fan folded or rolled linen as well as the mattress pad and draw sheet or waterproof pad over the edge of the mattress from the head up to the foot of the bed. If the bottom sheet is fitted, pull the corners over the edges of the mattress. If you are using a flat sheet, unfold and pull the sheet toward you. Miter the top corner of the bottom flat sheet. Facing the side of the bed, grasp the remaining edge of the bottom flat sheet. Lean back, keeping your back straight, and pull the sheet, tucking the excess linen under the mattress from the head to the foot of the bed. Make sure the sheets and the pad are smooth and wrinkle-free.
I guess what that's one, kid.
Cover the patient with a top sheet, placing the vertical center fold lengthwise down the middle of the bed. Open the sheet out from head to foot as you unfold it over the patient. Be sure the top edge of the sheet is even with the top edge of the mattress. Have the patient hold onto the sheet and blanket. As you remove the bath blanket, place a clean or reused bed blanket over the patient. sure the top edge of the blanket is parallel with the top edge of the sheet and 15 to 20 centimeters from the edge of the top sheet. Go to the other side of the bed and spread out the sheet and the blanket evenly. Make it cup by turning the edges of the top sheet down over the top edge of the blanket. Standing Standing at the side of the bed, tuck the remaining portion of the sheet and blanket under the foot of the mattress. Tuck the top sheet and blanket together, being careful not to pull out the toe pleat. Make a modified mitered corner with the top sheet and blanket simply by leaving the tip of the triangle hanging rather than tucking it in. After you make the triangular fold, go to the other side of the bed and repeat. Make a horizontal toe pleat by standing at the foot of the bed and fan folding the sheet from the bottom to make a fold about 15 centimeters from the bottom edge of the mattress. Apply a clean pillowcase. Pick up the center of the closed end of the pillowcase. Hold the pillowcase with a firm grip in one hand. With the other hand, open the pillowcase from the open end and fold the back over the closed end, inside out. Pick up the pillow with the hand holding the pillowcase. Invert the pillow or the pillowcase to drape over the pillow. Pull the pillowcase over the pillow with the other hand. Do not place pillow or pillowcase under the chin, in the teeth, or under the arms. Adjust the corners of the pillowcase with your hands between the pillowcase and the pillow. Do not shake the pillow or position the pillowcase.
Alright, here's a new pillow for you.
Help the patient into a comfortable position to ensure the patient safety. Raise the appropriate number of side rails and lower the bed to the lowest position.
Would you like your head raised up,
Place the
Parker?
call light within easy reach and make sure the patient knows how to use it to summon assistance.
How's
Place the
that?
linen bag. Place the linen bag in an appropriate receptacle. Dispose of used supplies and equipment. Remove and dispose of gloves if used. Arrange and organize the patient's personal items so they are
Are you
within
comfortable,
reach.
Parker? Okay, here's your call light if you need it. Anything I can get for you? Okay.
Perform hand hygiene, document, and report the
Perform
patient's
hand hygiene.
response.
Make sure the unoccupied bed is in the locked position. Raise the bed to a comfortable working height. Lower the side rails on the side you will work on first. Apply clean gloves. according to agency policy. Dry the mattress thoroughly. Remove and discard your gloves and perform hand hygiene. To make a surgical bed, the linen is used in the same order as when making an unoccupied bed. See the video for making an unoccupied bed. Make sure the fitted sheet is placed smoothly over the mattress and over the top and bottom mattress edges. Fit the corners on one edge, then on the other. Place the top sheet over the bed with the vertical centerfold positioned lengthwise down the middle of the bed. Open the sheet out from head to foot, being sure the top edge of the sheet is even with the top edge of the mattress. At the top of the bed, make a cuff by turning the edge of the top sheet down. Turn sheet down over top edge of blanket or bedspread if used. Fold all the excess linen from the foot of the bed to the corner to the center of the mattress so that the linen is even at the foot of the mattress. Fold the corners towards the opposite side of the bed to form a triangle. Fold the hanging portion up, move to the other side, and finish making the bed. Fan fold the linen towards you on the side of the bed opposite that which the patient will be transferred. Apply a clean pillowcase and lay the pillow at the head of the bed. View the steps for applying a pillowcase in the video for making an unoccupied bed. Leave all side rails down and place the bed in the high position to match the height of the stretcher.